Hey, hey. Hey, Mabina. So in today's show, we will be talking about dental hygiene, and we'll be doing that with Dr. Patrick Bannerman-Agbesi. Guys, so with that being said, let's invite Dr. Patrick Bannerman-Agbesi on board. Hi,
Hello,
Dr.
hello, everyone.
Dr. Bannerman, you're welcome to the AJY show.
I am
Dr.
very
Bannerman,
happy to be here.
how are you doing? How is everyone? Guys, Dr. Bannerman is a husband and also a daddy too as well. So Dr. Bannerman, today being your first time on AJY show, kindly introduce yourself to my family.
Okay, hello, everyone. My name is Patrick Bannerman-Agbesi. I work as a dentist. I'm a family man, father of two. Friends to Kelvin and some other team members. I work at Sam J Specialist Hospital. It's a private practice hospital in Hacho, Ekomok. And yeah, generally that's about that.
Okay, Dr. Bannerman, you're welcome again to the AJY show. So guys, see, Dr. Bannerman is very, very friendly. You can just watch this.
I'm about to get my removed. Yeah, I'm here to support. And I'm here to do the freaking audit.
Guys, that's Dr. Bannerman in action.
AJ's husband.
Yeah, so after watching this, so guys, Dr. Bannerman, I always have this question in mind. I want to ask you, does baking soda really whitens the teeth?
AJ, that answer, if I give it to you, the baking soda in Accra will finish. So I'll be political with my answer.
Okay.
It has a potential of doing so, but it is not advised. It has a potential of doing so, but it is not advised.
Okay. So don't forget to hit the like button and also share this video. As he said from Dr. Bannerman, it has the potential to do so, but it is not advisable. Guys. So the first question, I have some questions. So before Dr. Bannerman will talk, guys, after Dr. Bannerman's submission, you can also bring in your questions. So please get your question ready. I'll move on to your question after he's done submitting. So Dr. Bannerman, the first question is, give us your general overview.
AJ, call me Patrick. Call me Patrick. Dr. Bannerman is a mouthful. Call me Patrick.
Okay. It's very difficult for me to call you Patrick because it's not easy. It's not easy to get there. Okay, as you say so, Patrick. Oh my goodness, this is very, very heavy. Okay, Patrick.
Yes.
The first question is, what's the general overview of a healthy tooth?
Okay. So a healthy tooth would first of all be firm. Okay.
Okay.
It should be clean, and it should be functional. Those three things.
Okay.
Should be firm, clean, and functional. That's basically
That's so simple.
Yes, because we can jump around it in many ways, but then there will always be exceptions. Okay.
Yes.
So when I say a tooth should be firm, ideally the tooth is always found within the jaw space. There's a set below. Okay, let me put someone across. So hello, this is one of my friends here. So there's a set below, and then there's a set on top. So when I say the tooth should be firm, it should stay where it's supposed to be. It's not supposed to be swimming back and forth in the gums or in the bone. That's the main thing. The next thing is that the tooth should be clean. Okay. People have a notion of white. No, clean. Remember, clean. That's clean. If it is clean, it helps. because
helps.
white is a perception of sight is a perception of color. Okay, so we may perceive things differently. If you have a certain quality of light showing on an object, the image that the eye perceives varies from person to person. Okay, so in your line of work or what you choose to do for passion, you have all these quality cameras, 4K cameras, 8K cameras, all these resolution, all those expensive things. If you take a picture with an iPhone 6s, it's different from the Pro Max. Do you understand?
That's very true.
Exactly. And then if you start playing with the filters, it's another ball game altogether. So the concept of white, we usually don't like playing with this one, but clean is ideal. And then the last thing is that the tooth should be functional. What I mean by functional is if I didn't have any teeth in my mouth and it's just my tongue, my words would be like this. I'll not be able to speak properly. It doesn't work. So first of all, your speech will be impaired. Okay. Secondly, we love food. Everybody likes to have good food. Some garankinke with some pepper, some wache in the ahabine things. If you can't chew, your tooth is not helping you. Okay. So basically, for aesthetics, you have a nice smile, as you always do. Yeah. And then you also have. You can also chew your food properly, and then you can speak properly. So basically, if the tooth is firm where it's supposed to be, that's a good look. If it is clean, that's another good look. And then if it is functional, then I would put those under the categories of being a healthy tooth.
Okay. So guys, as you heard, for a tooth to be held, it has to be firm, clean, and functional. It has to function very well. So as you heard from Dr. Bannerman-Agbesi, as you heard from Patrick, sorry. He says I should call him Patrick. I don't know, my man. Oh, I can't because it wasn't easy for you to get there. So I can't just call you Patrick. So the next question is there any special diet for teeth?
Okay, so the teeth are usually formed whilst we're growing up. Okay, so babies or toddlers would have their teeth forming anytime from when they are born. So it starts within the jaw, and then at a certain point in their lives, there appears in the mouth. Okay. So when we're looking at diet, we're looking at every basic nutrient that everybody needs. I mean, a fair balance of your carbohydrates, your fruits, your vegetables, all those vitamins and things are necessary. Because the way the tooth is formed is that it's made up of a complex of proteins. So you don't necessarily have to say, oh, when I eat more chocolates, my teeth will be good. Or when I take more of this. We're always going with the concept that milk helps with forming strong teeth and bones because of the calcium that's involved. Okay. But at the same time, if you overdo your milk and you're not cleaning your teeth properly, you could also have some problems. So generally, it's more about the growing child and how the growing child is fed. Also, making sure that they don't fall ill, they're not being hospitalized every now and then. Because with whatever the body has to create these teeth, which you'll be using throughout the rest of your life, it's important that you get the optimum of these products or of these ingredients, if I should put it, to cook the ideal tooth. However, if a child is unwell, if the child is almost always in hospital, or they have some medical conditions that they are living with, you realize that they would have a problem with just thriving. So they don't get the best of nutrients and elements to put the tooth together. So kids like that are more likely to grow up with chances of having more cavities. They tend to have more cavities, or their teeth break easily, or they don't have the ideal healthy tooth. So generally, milk in a growing child is ideal. That's for adults, a fair balance of everything that is right. A fair balance of everything that is right. It's okay. But you can't pinpoint it on, oh, eat more fish, eat more that, eat more meat.
That's okay.
Okay.
So we should have a fair balance of everything.
Yes.
Okay, so the next question is some is there some things to avoid when it comes to teeth?
Yes. So there's this bad habit that a lot of us do. So this is one of them. So this is boys sitting in some pub or something, and then the opener is lying across the table, but everybody's in a hurry to take their drink. So
You use our teeth. Oh my goodness.
yeah, this is not an opener. I beg of you, this is not an opener. So people should avoid using their teeth to open bottles. Another thing too would be people use their teeth to open stuff generally. Or there's some zip is not working and then you need to put the dress together and then you go using try avoid opening bottles with your teeth. That's the main thing. Another would be what else? What else do people use their teeth for? Yeah, biting people. When it comes to fight and violence, people tend to bite others, and that's also not a very, very good thing to do. Extremes of hot and cold. Extremes of hot and cold. I know some people will argue that for their meals, if they don't see the steam blowing off the rice or whatever meal it is, it's very difficult to eat. But the tooth in its structure, the way it's formed, if you expose it to extremes of hot all the time or extremes of cold all the time, that also could be problems. I'm not going to say that nobody should eat ice cream. I'm sure somebody will come looking for me, give me a big one. But we should manage temperature, especially when it comes to meals. And then also very, very cold water. People tend to like that water that's so cold when it hits the back of their throats and it hits their chest. They have to, do this. Then they feel they're taking something in. So avoid opening bottles with your teeth. Extremes of hot and cold, basically. Those are a few things to avoid. Some of them may come up as we go along. So yes, I'll bring that back if I have to. Yeah.
Okay, thanks so much for that point. We should avoid opening our teeth with our bottles with our teeth. And also
Yeah.
we should avoid extreme hot or cold item. Thanks so much, Doctor. Do you know, I just remember something. I just had a flashback. Once I was trying
Okay.
opening a Coke bottle with my teeth and guy, I had portion of my tooth, some of my tooth there coming down.
Wow.
So I told myself
That's
I will never ever try that anymore. Not in my life.
you are lucky it stayed there.
Guys, can you see me?
Yeah.
Because I was having a little bit some difficulties, technical difficulties. Can you see me now? Is the audio okay? Eunice says she's at church. She would download it later. Okay, Eunice. But don't forget to hit the like button and also share this video. So, doctor, our next one is bad breath. What brings about bad breath?
Bad breath, it's a very dicey area to play around.
Okay.
There's genuine bad breath, which we call halitosis. Halitosis, it's a big word,
Yeah.
but simply. And then there's like false halitosis. We call it pseudo halitosis. So
Okay.
those would be in people who don't have halitosis, but they think they have halitosis. Okay. And then there's a line of mental diseases or mental disorders, which makes people just think they have it, whether they have it or not. Okay. But first of all, bad breath could arise from just anything, maybe a meal that you had previously in the past couple of hours. If you
Okay.
had something with too much onion or you had some beans, and then you haven't rinsed your mouth or had anything else, or you've had your mouth quiet, or you've closed your mouth for quite a while, your next expiration of air would give off a whiff of what you had previously. So that's one thing. But then most of the time, to a lot of the deposits from food that we eat sit on the top of our tongue, okay? The white part of the top of our tongue. So the tongue, as you'd have it as an organ, it's not very smooth. It's more like a carpet. So little pieces of food can stay on the tongue. And then we have normal bacteria that can break down some of these food particles, and then they give off some compounds. There's a lot of chemistry, sulfur and all that, but we'll stick to something very basic, which may come off as offensive to somebody next to you. And then generally also there's a line of medical conditions where people have problems with digestion. So anytime food hits their stomach, they're not able to properly balance out how the food is digested. So every now and then they'll be belching, burp, 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 and then that also comes out as bad breath for some. And also, if you have a cavity, if you have a hole in the tooth, what happens is that hole in your tooth becomes like, okay, you AJ, you're a lady, you cook a lot. I'm sure Kelvin was supposed to. If you have, let's say, groundnut soup, okay, that you just had from the stove, and you didn't let it warm or cool, and you just put it in a food saver bowl and put it in the fridge, it will go bad. Okay?
Yes.
As long as that bowl is covered in the fridge is okay. However, let's say there's a blackout, ECG, they took their lights, they brought it back 12 hours later. When you open that bowl, you realize that the soup has changed or it's going bad. In the same way, now that you've closed it, that smell has gone into the fridge. So the next time you happen to open the fridge, you realize that the entire fridge smells funny.
Yes.
And it's not because, let's say, the apples or the juice or something has gone bad. It's just that what has been opened, which had a very bad content, has held itself within the confines of the fridge. So it's the same thing about having a cavity. You have a hole in the tooth where excess food particles stay there. There's a grain of rice, some small fish, some small meat here and there. And it keeps going bad. It keeps going bad, and it's in your mouth. So traditionally, when the person opens, now the air that they breathe out brings all that to the fore, and then you have also that bad breath. So that's also one of them. And then the last one would be something we call, it's a big word. The math people would like it a lot. It's called calculus.
Calculus.
So calculus, yes. So whenever we eat, little pieces of the food stay in between our teeth, okay? Then the normal bacteria would act on it. Saliva also acts on it, and it stays in certain positions. That also breaks off every now and then, and it gives off this. So you see some people, they have these yellow things in between their teeth. Sometimes the color changes to brown or green or even sometimes black, and it's associated with bleeding. Those could also account for bad breath. So generally, it will be having a cavity, the calculus that we mentioned, probably the food you just ate. Those are some of the things that could give out some bad breath, or the medical conditions in your stomach or your abdomen. Yeah.
Okay, so before we continue, I think let's move on to our audience. Some of the questions from our audience, then we'll come back again. So this from Emmanuel Adua. Please, how many years does it take for your wisdom teeth to be fully grown? Because it seems mine has been growing in bits for some years now, which makes me feel uncomfortable during such times.
Okay, so this wisdom teeth matter there. We'll try. So what happens is that wisdom teeth are the very last teeth in the jaw bones, usually the lower part. Okay, the very big teeth. They tend to come out between the ages of averagely 17 to 27. Well, this is from the history of the history of Caucasians. I don't know much about Africa, but as it stands, it comes between the ages of 17 to 27. Okay, so what happens is that if you are just about 27 or past 27 and it's not fully out in your mouth, it's very unlikely that it would find a space in your mouth. Also because the space in the jaw, let's say, okay, we can use this as an example. Can our viewers see it? Okay, so the space in the jaw, If we don't have enough space for that very last tooth to come in, it will have a problem with coming up upright. So it might come out at an angle or might even be curved this way. So most of the time, we always ask everyone to see a dentist, a qualified dentist, like close by wherever you are, for an assessment, just to have your regular checks done. And then they can tell you, okay, at this your age, you are less likely to have your wisdom teeth coming out finally. We may have to investigate with some radiograph, that's like an x-ray, and now to show us the final position of the teeth that we are looking at. And then we'll know what your possibilities are, whether the tooth would finally come out or whether we would have to go in and take them out. So it will take about 27 years for it to be fully out. If it's not out by then we may have problems. But some people also do not have their wisdom teeth and they function just fine. So that's about that. Yeah.
Okay. With that being said, if you don't have any nearby dentist, you can visit Dr. Patrick Bannerman to check your teeth for you. Okay. So the next one is from Peninsula Sebo. Please, how will you treat bad breath? Sorry. How will you treat bad breath?
Okay, so Priscilla, from what I mentioned before, we have to find out the possible cause of the bad breath. So during your visit, we'll be examining your teeth to find out whether there are any cavities. Once we eliminate that, that's a good idea. Then we'll also look around for the deposits, that's the calculus deposits in and around the teeth. If those are present, a simple session of what we call scaling and polishing or cleaning would get rid of those deposits and you'd be on your way of eliminating the bad breath. And then we also look at your tongue. If you have quite the type of tongue that has more food particles sitting on it, it's not very common in this part of town, but we have something called tongue scrapers. So it's like this metallic thing that it looks like a hook. So people generally put it over their tongue and then scrape off any excess food particles that might be sitting on it. So in treating bad breath, we'd have to look for any cavities, eliminate the cavity if we have to, get rid of the deposits by doing cleaning for you or scraping your tongue. Those are the ways that we could help you eliminate bad breath.
Oh, okay. Oh, okay. So guys, for you to contact Dr. Agbesi at Bannerman, his information or details will be in the description box. So the next question is from Frida. Please, I want to know more about tooth decay and how to treat it.
Frida, that's a whole topic. Tooth decay in itself is a whole topic, but we can mention it. So what happens is that the tooth, let me do something.
So whilst you are waiting for him, okay, oh, he's back.
So small education here. We're taking guys back to dental school. Is this clear? Is this clear? Okay.
Yes.
So Frida, so generally, this is a diagram of the tooth. So I hope I'm getting this right. Yeah. So this is a diagram of the tooth. Okay. Good. So we have the crown, the parts you see in the mouth. That's the white parts. And then we have the roots. Okay. So the roots are embedded in bone and is covered by gum. That's the general structure of the tooth. Okay. So this is the model tooth called the molar tooth. Okay. So the crown that we have here has three parts. We have the inner core, a middle layer, and then we have an outer shell. Okay, so we have an inner core, a middle layer, and an outer shell. All these three parts are very, very important. So the inner core is like the heart of the tooth. We call that the dental pulp, P-U-L-P, pulp. Okay, so that's where your nerves and your blood vessels are. That's what keeps the tooth alive, and that's what keeps the tooth healthy. Okay, these nerves here, unlike the nerves of the skin.
So I think doctor is back. So doctor, please, is it okay now? Yes, perfect. It's perfect now. Perfect.
It's better. It's better now. Yes. So to Daniel and Daniela's question.
Okay.
To Daniel and Daniela's question, if it's best to see us during your second trimester, okay? Because what happens is that in the first trimester, you have the baby now forming and all that. Most of the time, the procedure of taking out a tooth during that time, it's I don't want to say it will not affect the baby, but we usually want to play safe. Okay, we will not want to we don't want to try taking out a tooth and somebody later come and say, God forbid, my baby has the nose is bigger than it's supposed to. So if the dentist who did it, we try and avoid that. So in the first 3 months, the baby is now forming. We want to give them as peaceful as an environment as possible to do so. And then usually in the last 3 months also, the anxiety behind having your tooth taken out for some people is sad that it could make them push and then feel uncomfortable in such a way that they may break water and then naturally the baby may come out. So people would want to stay clear of those two. So usually it's best to see you in the second trimester. During that time, things are usually more relaxed. The vomiting may have reduced, if any. The person can also sit properly, because sometimes the sitting positions in the chair too gets uncomfortable. You sit for a while, then they turn, oh, baby is kicking, have to lie down like this, lie down like that. So, but ideally, before one or a couple decides to get pregnant, it's advised that you see a dentist and then just have a general check and then make sure everything is in the clear. Also because pregnant women or women who are expecting tend to eat a lot or eat all manner of things at strange times of the day. It's 2 p.m., it's 2 a.m. and you want to eat yam and coke. You want to eat pizza at 3 p.m. And you know, because of the hunger, you just keep nibbling on things almost all the time. So if you had a cavity which was not even painful, now it's like you're introducing more frequent foods to a point where you're feeding the bacteria more and then it could become a problem. So usually we advise that you see a dentist before you try having kids. But hey, it's nature. So next thing you know, oh, I missed my period, and then you're going to have a baby. You don't know what's going on. So yeah, but if you do see if you do see your dentist regularly, these things would come up, and then you'd be in a better position to handle yourself better during the 9 months and beyond.
So, guys, if you want further information, just visit Dr. Bannerman's clinic and you'll be sorted. So, on that note, do we have more? Okay, so we have another question from Naomi Dakun. Please, can you tell us how to brush teeth and is it good to use hard brush or soft brush?
I'll take the second part first. It's not good to use a hard brush. We should not use hard brushes. Hard brushes tend to destroy the gums. Okay. When we're growing up, okay, so there's a model toothbrush here. I don't know if you can see it. Okay. When we're growing up, a lot of us were taught to brush like this.
That's true.
I grew up in some parts of Accra. If I mention the name, my gang people come and kill me, so I'll mention any names. But when we're being driven to school, you realize that the guys by the roadside are brushing and they brush with so much force that it's as if they are choking. Okay. The teeth are not meant to be brushed like that. And then also you're not supposed to use a hard brush. The hard brush doesn't help because you have both hard tissue, that is the tooth, and then soft tissue, which is the gum. So when you use a hard toothbrush, you tend to wear away the gum, and then that later on can give you problems. So the thing about brushing your teeth is we're taught to either go back and forth, or up and down, up and down. So those would help, but it is not ideal. So now we are advised to go in slow circular motions like this. So I'll brush my cheek for you. So this way.
Okay.
So that's generally how we go round, 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 round. And if you take your time, you realize that the bristles of the toothbrush would engage in between the spaces of the teeth. If you go back and forth, you miss out. If you go up and down, you might be pushing your gum up or down, depending on the amount of force you're using. So we advise you to go round, 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 generally, all around. Okay, and you have to brush every surface of the tooth. You have to brush the side, the part you chew it, and on the inside too. So if we, usually for the child patient, they like songs. So you have to sound like round, 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 then the underside, brush, 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 then the inside, flick, flick, flick. So with this, it goes like this. Round, 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 brush, 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 flick, flick, flick. Then you come to the next set. Round, 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 brush, 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 flick, flick, flick. Round, 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 brush, 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 flick, flick, flick. So you do that for all surfaces at the top, and you do that for the bottom as well. If you do this religiously, you realize that you spend close to 3 minutes cleaning each and every surface of the tooth. Whereas if you do it just as we traditionally do, spit once and then you go. Okay. And then there's another thing that I'll challenge us to try. Most of the time when you brush, you just spit into the bowl or your sink. Don't rinse with water. Okay. But we have the habit of rinsing everything out to the point where it's as if you didn't even brush your teeth. So the idea is the the paste should remain on the surfaces of your tooth to enable it bind to the tooth properly. Okay, so I'm sure, okay, fine. For the mornings, it might be a little difficult because maybe you have some of your wachi to eat or your tea to drink. So having a little bit of paste lingering on your tongue may affect your taste. But ideally, right before you sleep, when you brush, don't rinse your mouth with water. Just brush and spit out and let the rest of the paste remain in your mouth. And it will help with keeping the place fresh whilst you get at least your minimum of 4 to 5 hours of sleep before you go up and head out into the following day.
Oh, okay.
So that'll be for now. Yeah.
That's nice. Look, I've learned a lot. Guys, as I always say, if you are getting value from this video, don't forget to give this video a thumbs up and share this video. But if you want to contact Dr. Bannerman, please, his details will be in the description box. So we have another question from Anita Akusia in Japan. What causes bleeding when brushing the teeth?
So when you have deposits around your teeth, they tend to cause the gums to be inflamed. So the food particles that stay and then become hard, like those yellow things, it causes the gum to swell. Okay, so once the gum swells, what happens is the brain sends information to the gum send information to the brain that there's something close to us that is causing discomfort. So the brain will send more blood to the area in an attempt to remove the deposits. But you realize that the deposits are not in the gum, they are on the tooth itself. So it's like the more blood just rushes into the area and stays there. So now that you have a gum that is fully filled with blood, the least pressure that is applied to it to cause it to bleed. So generally, if you have a good session of cleaning, you remove the deposits from the side of the tooth to a point where now the gum can reattach to the part of the tooth that it's supposed to be, and then the bleeding would reduce or stop entirely.
Oh, okay.
So you probably would have some disease or have to get some cleaning done, and then the bleeding will stop. That's
okay, Doug. We have some few minutes to go, so I'll fast track the questions to you so that we can at least answer a lot of questions. Okay, so we have Barbara Beckham. What causes the green color under the teeth?
So that is just an upgraded calculus. So the color of the calculus would show the type of bacteria that is working there. So if it will initially start off as yellow and then may turn towards green, then brown, and then black. So she would need to see a dentist for some cleaning to be done. And then, because there's no green yet, gum is pink or red. Traditionally, gum is pink. Okay. So if you're seeing anything green there, it doesn't belong in your mouth. It has to go.
Okay. Okay. So this one too is from Dr. Please, what type of mouthwash
Okay.
should we use?
AJ, at this point, I'll say that I am not an influencer dentist. Nobody pays me for saying that mouthwash A is better than mouthwash B. I am not an
Okay,
ambassador
so the
for any
question,
of the
okay, so
brands.
what
I
should
can't
we
speak
look
for
out
them.
for when buying mouthwash? That should be the question. What should we look out for when buying mouthwash?
Okay. So the main thing is that some mouthwashes, they're just cosmetic, okay? So a lot of the Listerine products tend to be good. I say that because that's what you generally find in the pharmacies, okay?
Pharmacy,
But then
yeah.
there are two other mouthwashes in particular that we tend to come across. One of them is this one. Oops,
Close.
can you see it?
Yes,
Good.
close.
Close. There's another one too called Cosodil.
Cosodol, yeah.
Close and Cosodil. So I'm not saying that these ones are good. These ones are actually meant for therapy. So if somebody comes in with bleeding gums, sometimes after the session of cleaning, we may put you on this one as a prescription for just a maximum of 2 weeks. But what happens is that because somebody said, oh, this is what the dentist gave me, and then they will not remember the full story behind it. They might just walk into any pharmacy and say, oh, I want Close. The dentist said it's good. What happens is that there's an active ingredient in this particular type of mouthwash, okay, which when you use it over a long period of time would make your teeth brown.
Oh, okay.
Your teeth will look like somebody who actually drinks coffee all the time or probably smokes. Okay, so these are not meant for everyday use. They are used only on direction from your dentist, and it should be used for just about 2 weeks. So please, I am not telling you that this is what you should go and buy. I'm saying that if you had an opportunity to use this a little beyond 2 weeks, you have to stop entirely, or else long term it will discolor your teeth and your teeth will come in as yellow or brown. Your teeth will actually change color because it has stains in it that if you are using it every day, that's going to be the problem. Yeah.
So guys,
but
that's
generally
what
the
I
cosmetic
always tell
ones.
you that visit Dr. Bannerman for more tips when it comes to the teeth. Guys, you should visit him. You should visit him. You learn more from him. He has time for all his patients. Doctor, don't give all here. Don't give all the info here. Keep some. So when they come, you just give it to them.
Sure.
Okay, so we have this one from Lori Lawson. Please outline your prices for cleaning, booking, etc. So I have fair idea before coming. Thank you. You said laugh out loud. Thank you.
Oh, Laurie. Laurie, we don't discuss numbers. We don't discuss numbers or tell us to call you or something, but we don't discuss numbers on the phone.
Yes.
Generally.
Yes. So all that I can say is Dr. Bannerman is very affordable. Yes. He's very, very affordable. Guys, trust me.
And then we do pay plans as well. So we do pay plans as well. So if you don't think you have enough for the time, whatever we can do for you, we will do for you.
Do it.
And then we just trust that there are still good human beings out there. So when somebody owes you some money, they send it to you in good time. Then everybody can benefit from the service. So it's not the cash is not giddy. The cash is not giddy. It's risky, but hey, Charlie, we don't always have an amount for certain things. But if we have the opportunity to get it done, we will get it done.
It all depends on the cases that come to. Sometimes the price depends on the case. Yeah. So this one is from Dapa. How can you make your teeth white when they are brown or yellow?
Okay, so first of all, you can have cleaning done.
Okay.
Because some of the stains are just on the surface of the teeth. So once we do the scaling and polishing, that can actually make your teeth appear cleaner. Also, you can also do teeth bleaching, okay? But that one, we have to be very, very, very careful. So in the past couple of years, let's say in the last 2 years, there's been this fad about teeth whitening sessions, laser something. I would want to bring a note of caution to your cherished viewers, because this thing is actually becoming a problem to the fraternity of dentists. So you have people who are not trained as dentists doing this procedure because it's like going to the cosmetologist. It's like going to like a salon to have your nails done. Okay. But it's like the person who is doing your nails is not a manicure expert, or like it's not a beautician, if I should put it. And then later on, when you have problems with what they have done to you, then you run over to the dentist to come and solve your problem. So they are strategically positioned in some parts of Accra. I mean, very nice places. They say, oh, you can get your teeth looking like this to this in 5 sessions, in 10 sessions. And then they put these outrageous prices there. You can double the
Okay.
Interestingly, they would have some celebrities and influencers also jump and say, oh, come and get this done, come and get this done. But please, before you give your mouth to somebody to do something, you would have to inquire whether the person is qualified to do what they say they can do for you. So that when you have problems, you know where to go to. So please, yes, teeth whitening or teeth bleaching is possible, and it's best done within the clinical setting, not within these salons or parlors as you have them driving around. Because when you go back there to have a problem, they can't help you.
Yes, thanks so much, doctor. Okay, so doctor, we have just some few minutes to go. So we'll just give 60 seconds to every question. So the next question is from brother. Please, can you tell us how many minutes we should use to brush our teeth? Because sometimes we brush for long, our gum end up bleeding.
Okay, so you should brush for 4 minutes.
4 minutes.
4 minutes.
Okay, thanks so much. So we need to brush our teeth for just 4 minutes. And you have to go in circular motion, not up and down, not so just in circular motion. So the next one is from Margaret. Hey, Margaret said, I'm here. Oh, yes. So Margaret, thank you so much for being part. So we have another one too from Rays of Love. Rays of Love. So you said very educative episode. Oh, thanks so much, Rays of Love channel. Thanks so much. Team AJ, we are here. Yes, Team AJ, people are always the best. Thanks so much. So, okay, doctor. So we have this one from Jemima. Please, my teeth is cream, but I want to make my teeth to be white. What should I do? I think you just answered it in the previous question. So move on to the next question. So this one is from Jessie Jewa Ajekum. Okay, so we've also answered this question already. We've done this one. Yes.
Yes.
Someone is saying, please answer my question from Gina. So we've done this question too already. We've done this one too.
Thank you, Laurie. Laurie knows. Laurie's on point.
Laurie's answering Jessie. Thumbs up, Laurie. Thumbs up. So this one is from Bokula. She says that, I don't know if it's she or he. So please, doctor, my daughter is 5 years old and her teeth has started falling off. Is it normal or for her age? Is it normal for her age?
It is. Okay. It's very normal. So
it's very normal.
The lower front is very normal. You have the lower front ones falling out, and then the ones on top also falling out, and then they would continue up until the time she's about 10 or 11. So it's okay.
I remember when we were using motorway. When we were kids. So this one is from Gina. Oh, Gina, finally your question has arrived. Gina says that, what is the causes of swollen gum? So this one is from Gina's Lifestyle and Vlogs. She's a YouTuber too as well. So don't forget to subscribe to her channel as well. So she says that what causes swollen gum?
So an infection can cause a swollen gum. If it's
Okay.
usually associated with one particular tooth, which may have a cavity, it's an indication that the tooth has had the infection progress from inside the tooth through the bone and hitting the gum. Okay, so it will come out like what we usually call, it's like a pimple.
Mm-hmm.
Yeah, it's like a little pimple by the side of the tooth that has a problem. That's usually a very bad situation that may need a dentist to you need a dentist to take a look at it.
Okay, so thanks so much, doctor. So this one is from Doreen. AJ, please, what happens to those of us that spend 1 minute brushing our teeth? Good vibes, good vibes, good vibes. Hand wash, hand wash. I fall into this category. The way I can spend my time brushing my teeth. So that's why I said I have learned a lot from you.
During the 1 minute there, I beg, make it 4.
4 minutes. Oh wait, then I'm not in the 4 minutes. I didn't really get the question.
1 minute. 1 minute. Yeah, 1 minute. 1 minute.
So Doreen, 1 minute is not good. 4 minutes is the best, and also brush in a circular motion. That's what doctor said. So this one too is from Laurie Lawson. Laurie Lawson said, I must book this doctor. Yes, you should, Laurie. Laurie too is a YouTuber as well. I think maybe when she's coming, she will bring her camera too. She doesn't go away, and leave her camera aside. She always move with her camera.
Yeah.
So this one is from Margaret Boatman. Sometimes I feel like my teeth is removing. Is it normal?
No, it's not.
So Margaret, it's not normal for your teeth to be.
It's not normal.
Yes, it's not normal.
Feel like it's removing. It's not normal. Unless I don't know what age Margaret is, but I don't think Margaret would be a child. If it's an adult who feels her teeth is removing, she'll need to see a dentist. Because like I mentioned, it's one of the general things would assess for health, that the tooth is firm and then it's clean and it's functional. So if she feels it's moving, there could be a problem with the support of the tooth, which is the gum and the bone. That can be assessed and then should be put on the road to better health.
Okay. So Daniela, I can see you all. Daniela too is a YouTuber as well. So this one is for Miss World. Glad I made it here. AJ, you're looking great as always. Thanks, dear. We'll want to know what causes toothaches and if there is specific ingredients we should look out for in our toothpaste and type of toothbrush. I think we've answered some of the questions already in the submission. So I think you just have to be quick in the answering. Just brush on it because we've already done that.
So you can have cavities. Cavities can cause toothache, and then trauma. If the tooth is fractured or broken, that can also cause toothache. Those are the two main things that we can, infection and then trauma. Those are the main things. And then the ingredients you should look out for in the toothpaste would be mainly the fluoride, Just make sure there has some amount of fluoride in it. That's okay. Okay,
doctor. Thanks so much. So this one is from decay and family. Which age are you supposed to develop teeth, also known as the wisdom teeth?
So between 17 and 27.
17 and 27. So this one is from Richard Asiedu Enchi. Is halitosis curable?
Yes, it is. It can be managed. We would use the word managed. It can be managed, yes. Based on what the causes are, we can manage it.
Okay. Thank you, Doctor. Halitosis can be managed. Thank you. Dr. Ofekin, is it normal for the tongue to bleed when brushing it? Or I am being too hard on my tongue? Dr. Ofekin said that.
Yes, I think
is it normal?
You're being too harsh. You're being too harsh on the tongue. Go easy on the tongue.
Yes,
Just
please be easy on
gently,
it.
gently.
Pamper your tongue, pamper it. Okay, this one too is from Dapa. My friend's mom, all her teeth came out when giving birth to her daughter, I think. And why is it so?
Dapa, wow. All of the teeth came out. Um, you see, the thing about pregnancy is a very interesting state.
Okay.
Okay, it's a very interesting physiological state. You have
Mm-hmm.
hormones going all around, spiking and dropping and all that. Um, Generally, these hormones also tend to influence how the structure of the bone and the gums that hold the teeth also play out. So depending on, but this could be more of a very unique situation with regards to your friend's mom. It's not something that happens in the average woman. So she may have some other underlying medical condition that may have caused her to have that. But it's not something that I can answer just with the information
Yes,
you
yeah.
have.
You need to
Mm.
assess her before. Okay, thanks so much,
Yeah,
doctor.
but maybe there was something going on.
Yes, yes. Okay, Doctor Veronica. This from Veronica Jimine. Doctor, can coke decay your teeth? She
Yes,
says can
it
coke
can.
decay.
We like Coke. Coke there we like, but
We should limit
so
it.
Coke has a high, yeah, Coke has a high sugar content. Okay. So the idea is if you keep exposing the surface of the tooth to a lot of sugar, when I say sugar, it's not just like cube sugar, but anything that is carbohydrate that can be broken down by bacteria, you tend to give the bacteria a lot more to eat on, and then you can start having cavity. So she can have the Coke as I mean, I can't tell her to stop drinking Coke. I don't know. She would probably kill me if I say that. So Veronica, what you can do is after you're done having your Coke, let all the sweetness go in. You can just take like half a glass of water and just rinse your mouth a bit. So that will just dilute a lot of the excess sugar that is
Sugar.
sitting around, and then you can spit it out, and then it will reduce the amount of available sugar made available to the bacteria. So you can drink your Coke. Of course, drink it in moderation. Be very careful
Okay,
about that. I mean,
Doctor.
there are
Thanks
other
so
medical conditions that can come out. Yeah,
Okay, we will always rinse our mouth after taking in sugar, sugary food.
yeah,
Okay, so
that
this one is
helps.
from Elizabeth Ohenewa. Please, how can you whiten your teeth? Oh, we've already answered this question, but I think if
Yeah,
maybe he should just join us,
it
so
can be
if
done
you
within. Yeah, we
by
can.
calling.
It can be done within the profession.
Yes. Okay. So this
Race
one
of
is from Race of Love channel. Please, Doc, when should one visit the dentist within a year? That's a very great question.
Okay.
So
So
that one, he's
usually,
also a YouTuber as well. It's a YouTube channel.
okay, so wonderful, wonderful. So it's best to see the dentist twice in a year for your routine cleaning and checkups. Okay.
Okay.
The reason being that a cavity that starts off can take a minimum of 3 to 6 months to become very, very problematic. Okay. But if you are coming in for your regular checks and you're having a very good conversation, we would be able to identify that, okay, um, okay, let's say AJ started doing a weekend program at Game Park. So now over the weekend, she doesn't sleep much. She's drinking Coke and tea to keep up to study. So if we are going to project that your dietary lifestyle is going to change to
Change.
suit a certain phase of your life, then we can advise you as to how you can manage those things. But a lot of
Oh,
people don't come, and then we only see them when they're in pain and there's nothing to do about it. So you should see the dentist twice a year, preferably to kickstart of your year. Somewhere in January and somewhere in June will be fine. So we see you first first month in the year, and then a little after July, and then we are good to go. So we should see the
okay.
dentist twice a year
Twice in a
for,
year.
for your routine checks and
Okay. Okay. So you should see the dentist twice in a year for a routine check. Okay, this one is from Godly Inspiration Channel. She said that what about those who has hole in their teeth? If you
Okay.
have hole in your teeth,
They have
they have to
they
visit
have
the
to see
dentist.
a dentist.
Yes.
Yeah, they have to see a dentist and have it at home. Most of the time, a quick filling can be done to solve it, or something else could be done to solve the problem.
Okay, okay. This one is from Miss World. How can we prevent tartar on the teeth, please? Tartar.
You really can't prevent it. Tartar is the
Okay.
calculus we're talking about, the back,
Oh,
the deposits. Yes,
okay.
you can't prevent it as long as there's saliva in your mouth, as long as there's bacteria in your mouth, and as long as there's food, tartar would form, whether you like it or not.
Or not.
But of course, the quality of saliva you have would influence how fast the deposits will come. Also, the quality of meals you have would also influence that. And then finally, the arrangement of your teeth. If your teeth are nicely spaced out, okay, they are less likely to form. But if your teeth are very, very close, they are more easily formed.
To
Yeah. So you can't really prevent it. You can just have them cleaned regularly at the
okay.
dentist. Yes. I think we've seen the
Answer
question.
this question too as well.
Mhm.
So I'm just glancing through to bring more questions on board, the ones we've not been able to answer. So we have just some few minutes, just let's say 3 minutes to go. Because I thanks so much, doctor. God bless you.
God bless you too.
Yes. Cafe Praise Film says that please, assuming you lose one side front teeth, is it advisable to fix a denture or leave it? You
Wow.
lose one side of your
That's
front teeth.
um that's it's you see, society has ways of appreciating people. If if you lose a tooth, you might get a little more attention from onlookers or other people. It's part of your personality as an individual to have a nice set of clean, firm, and functional teeth. And in the function, the aesthetics is very important. So if all of a sudden there's a missing tooth, ideally it's best to replace it. Okay,
Okay.
you'll be able to fix a denture. That's one of the options of replacing them. But there are other options also. You see, the dentures are removable, so that one you can put it on and you can take it off.
Sorry.
So this is how the denture looks like. I don't know if you can see it. Okay. Okay. So this is replacing some teeth.
Okay.
So this is how the denture looks like. So that one is removable. You put it where it's supposed to be. When you're going to sleep at night, you take it off. But there are some
Okay.
also that are permanent. Okay. So with those ones, we do a little skirmishes on the tooth. We send some measurements to the lab, and then they bring back the restoration. So those ones too can also be done. So the options of replacement are not only dentures, but in the end, it's the individual who will decide what he wants. But we would encourage that if you want to have it replaced, we can assist you to do that. But it's up to you to decide whether you want to replace them or not.
Okay. So the decision lies in your hands. So this one is
Yeah.
from Bokla. Please, Dr. Mine. Oh, we've already answered this question.
Mhm.
So I think, yeah, just let me 2 minutes to go. 2 minutes. 2 minutes to go. Miss Swan said, wow, that's great information, Doc. Thank you and God bless you. That's all Pekin said. God bless you, AJ and Doctor, for educating this. Oh, thanks so much. Amen.
Mhm.
Amen. So, Doctor, I've really learned a lot from you. I've learned a lot from you. Thanks so much because I never knew how to brush your teeth. I mean, I always brush vigorously. But I've learned that you should take our time when brushing our teeth and also brush in a circular motion. Thanks so much for honoring our invitation and coming to educate us on how to care for our teeth. We really learned a lot from you. Thanks so much. But if we're not able to answer your question, sorry, we've exceeded our time, 28 minutes, guys. Oh, we are so sorry we were not able to answer your question. We'll still have this session with Doctor again, then you can ask your question again. So thanks so much, everyone, for always coming in your numbers to support AJEMO. Thanks so much, Doctor, for always also coming. Thanks so much for coming to also educate us. So as I always say on AJEMO, we educate.